Namaste, good afternoon. I have here with me a very esteemed and distinguished guest, Professor Shubhini Saraf. She's the Director, National Institute of Pharmaceutical Education and Research, or NIPER, at Raebareli, India. Thank you for coming. Thank you for taking your busy time off your schedule to join us here. So how do you find the event so far?
So the event has really been good, and the best part I appreciate about the entire event is that there could be so much which would be lost in our books, in our ancient text, which is now coming up, being scientifically investigated and being given to the world. So that is the best part about Patanjali University as an institution, and I'm really grateful to Swamiji and Acharya Balkrishna ji that they thought about such a concept and they have made this wonderful university over here. This is the first time that I'm coming here, but I'm really amazed at the kind of infrastructure, the kind of work that's going on. It's really good, and you are also taking in people from outside, you are interacting with them, you are growing your network, you are growing the knowledge base. So all this is very creditable about this organization.
Very, very nice, very supportive, very encouraging word from Professor Shubhini. So the work that we have done at the moment is bringing traditional medicine and then science together. So what advice will you give to our scientists, to Patanjali, as we move forward to this journey?
So probably the problems that one may encounter in the future is things like interactions which may occur with, let us say, the allopathic and the Ayurvedic system of medicine. So there's a thing called pharmacovigilance. So you need to be vigilant about these kind of interactions, because sometimes people feel that Ayurveda does not have any effect and you're taking just the allopathic drug. That's how they treat it. But if there is a dual effect that's happening, Ayurveda is also acting and allopathy is also acting, it could go beyond what is required. There could be toxicities. And so it's very necessary that a huge database of patients be made, and this database should talk about other medication that people are taking apart from the Ayurvedic formulations, and then it should be shared with the world that these are things which you need not take together. If you're taking this, you need to talk with your doctor, etc. These are the things like pharmacovigilance, materiovigilance. These are the newer things which need to be taken care of, so that mainstreaming of Ayurveda, mainstreaming of scientific formulations made from Ayurveda can happen, and any doctor and any drugstore can then be keeping, prescribing, giving drugs side by side.
Oh, very, very nice. Put this thing together as we move forward in the next future. You were talking about ethnopharmacology in nanobioscience as well. So what is your vision for ethnopharmacology in the near future as we heal the world for humanity?
Okay, so there are a lot of synthetic drugs which are available. They could be a shortcut to wellness, but I feel personally that there are many diseases which have absolutely no cure available in synthetic molecules. And so Ayurveda, like let us say liver diseases, there is nothing available in normal allopathic system of medicine even till date. And we go back to herbal, so whatever formulations that are there are all herbal formulations. So I believe that nature has all the answers. The only thing is that probably we have lost some of it that we already knew, and there is a lot over there which is yet nascent and which is willing to be explored. So we should go ahead with that. That is my vision, that probably nature will be able to cure so much faster than man in his synthetic endeavors.
We also share the same vision as you. Just give one line about Patanjali Research Institute.
It is a very awesome organization doing some very good work, and people at large, society at large, should be very supportive of all the endeavors that they have, and all the institutions that exist need to also join hands with them in this endeavor, because they have already reached a stage and they are just waiting to be launched in a very, very good way.
Thank you so much, Professor Shubhini. We are so grateful to have her presence here despite her busy schedule from the university. Thank you so much, and we hope to see you again in the next future.